Hello everyone, in this video we are going to discuss about cerebrospinal fluid. It is also called as CSF, and CSF, it is a colorless liquid which protects brain and spinal cord from physical and chemical damage. It circulates through the ventricles of brain, subarachnoid space and central canal of the spinal cord. So I am going to discuss about the ventricles of the brain in the next part of the video, so please do watch continuously, and I'll give a detailed explanation of the ventricles of brain so that you can understand it easily. And next, coming to contents of the spinal CSF. So here we have glucose, lactic acid, proteins, urea, and electrolytes like potassium, sodium, magnesium, calcium, bicarbonate, and lymphocytes. So these are all the contents which are present in the cerebrospinal fluid. Nextly, when we talk about the cerebrospinal fluid volume in a healthy adult, it is 80 to 150 ml is a normal count. And nextly, the functions. The first and the foremost function of the CSF is it provides the chemical environment for neuronal signaling. Next function is physical protection, shock absorbing medium. That means it prevents brain and spinal cord bouncing on the bony surfaces like cranial cavity, vertebral column. So these are all the bony surfaces which we can count in. So from this bony surfaces, CSF protects the brain. And next, coming to the third function and the last function of the CSF is exchange of nutrients between blood and nervous tissue. This is the last function. So here comes the interesting part of the brain. It is the ventricles. So there are, as we all know, four ventricles, two lateral ventricles, third and fourth ventricle, and one ventricle is present in the each hemisphere. And the separation between each two lateral hemispheres is called the septum pellucidum. Let's look deep into the ventricles now. Ventricles, as we said, there are two lateral ventricles, one third and fourth ventricle. Firstly, when we take about this lateral view, we can see this pinky part as the ventricles, and this is the coronal section in which we can observe clearly. Firstly, when we talk about the lateral ventricles, there are paired, that means two C-shaped chambers in each cerebral hemispheres on both sides of the brain, right and left hemispheres. We have two ventricles. So on the right side, the right ventricle is present, and in the left hemisphere, left ventricle is present. And these lateral ventricles are the largest ventricles when compared to others, and these are present below the corpus callosum. And next, coming to interventricular foramen, it is also called as foramen of Monro. It is nothing but the connection between the lateral ventricles to the third ventricle. So this lateral ventricles are continued to third and fourth ventricle. So the connection between the highlighted part you can see in the picture. So the highlighted part, it is the interventricular foramen, or it is also called as foramen of Monro. And when we come in talking about the third ventricle, it is a midline and narrow space between the left and right diencephalon. So this is the left and right diencephalon. In between that third ventricle is present. It is a narrower space, and this third ventricle is laid in between the thalamus and hypothalamus. Next one is cerebral aqueduct. It is also called as mesencephalic aqueduct, and it is also called as aqueduct of Sylvius. So these are the common names we can hear around. And nextly, it is located in the midbrain, and it is the connecting part between the third and fourth ventricles. So third ventricle which continues to the fourth ventricle, and the connection in between these two ventricles is called as cerebral aqueduct or aqueduct of Sylvius. And next, when we talk about the fourth ventricle, it is located between the pons medulla and cerebellum. So you can see here pons, medulla and cerebellum, and the middle part, it is called the highlighted part, it is the fourth ventricle. And let's revise it once again. So So you can see this C-shaped parts. These are the lateral ventricles present on the either sides of the hemispheres, left and right hemispheres, and the middle one is the third ventricle, and the next leading part, it is the fourth ventricle, and the middle connecting part, it is the third ventricle. In between third and fourth ventricle, it is the cerebral aqueduct, the connecting duct between third and fourth. It is the cerebral aqueduct or duct of Sylvius. The fourth ventricle has two lateral apertures on the either side of it. So coming to the last and final interesting part of this video is cerebrospinal fluid circulation and absorption. So firstly, we all are knowing it that cerebrospinal fluid, it is produced in the choroid plexus. From there, through the lateral and median aperture, it flows through the brain and spinal cord. And nextly, the CSF is absorbed in the arachnoid villi. CSF, when it is circulated through the brain and spinal cord, some of it is absorbed into dural venous sinuses, and from there it is absorbed by the arachnoid villi. So this is all the explanation about the cerebrospinal fluid circulation and ventricles. So I used to feel this as the toughest part when I was a student. So I tried to manage and explain you regarding this and made it easy for you. I hope this is helpful for you guys. If you feel this video is helpful, please leave a like, share and subscribe to the channel, and also share with your friends.